Hello, everyone. Welcome. We will get started in about 1 minute. Thank you so much for joining us today. Great. Well, I see the numbers beginning to dwindle down. Thank you all so much for attending today's webinar, Respite Care Provider Training Lessons from the States. I'm Kimberly Hodges, a policy associate at the National Academy for State Health Policy, and I will moderate our time here today. Next slide, please. I would first just like to give a big thank you to our funders for their support of NASHP's work in respite care and family caregiving writ large, including today's webinar. They are the Administration for Community Living and the John A. Hartford Foundation. And this webinar and the work detailed here today would not be possible without their support. Next slide, please. So for our agenda today, we will first hear from Jill Kagan. She is the director at the Arch National Respite Network and Resource Center, and Lori Salbaum, the Lifespan Respite Program Federal Projects Officer at the Office of Supportive and Caregiver Services within the Administration for Community Living. They will both provide introductory remarks and background to frame our discussion today. And then we will then hear from Lisa Snyder, the Executive Director at the Respite Care Association of Wisconsin, and Dr. Kim Whitmore, Assistant Professor at the College of Nursing at Marquette University. Both of them are so integral to this respite provider training curriculum and will lay out its foundational elements and its evaluation results, really with a focus on lessons learned and tips for those who wish to implement this training. And then lastly, we'll hear directly from a state, South Carolina, and that is Kathy Mayfield Smith. She is the Associate Director at the Institute for Families and Society and the board chair of the South Carolina Respite Coalition. And she will outline South Carolina's approach to implementing the training curriculum. Next slide, please. And then I need to just quickly cover a few webinar logistics before I pass it on to my colleagues. We have reserved some time for questions at the end of the webinar, but you can send in those questions via the Q&A feature at the bottom of your screen. But you don't have to wait until the discussion time to send in your questions. Instead, please feel free to submit them now as they occur to you during the presentations, and we'll make sure to respond to them during the Q&A time. Additionally, if you would like closed captioning, you can select that by pressing the closed caption button at the bottom of your screen. And lastly, we will distribute the slides and the recording to all those attending, and we will also post it on our NASHP website. So with that, I will pass it over to Jill Kagan. Jill?
Thank you so much, Kim. As Kim said, I'm Jill Kagan, the director of the Arch National Respite Network and Resource Center, and I'm really delighted to be here with all my colleagues today to share these very important resources and lessons learned from the joint initiative we undertook with NASHP and the Respite Care Association of Wisconsin to develop and test the first ever competency-based training specifically for entry-level respite care providers. Next slide, please. Arch is funded, for those of you who are not familiar with us, Arch is funded by the Administration for Community Living to provide training and technical assistance to the Lifespan Respite Care Program grantees, to other state and local agencies and providers, and to family caregivers, and to the respite field more broadly. Next slide, please. I thought it might be helpful to just provide a little bit of context so that we're all on the same page about respite and what it is and the benefits and how it's accessed by family caregivers. And at Arch, we do focus on respite care, which simply defined is time away from caregiving. It's one of many caregiver supports, but we know that it ranks as the top need among family caregivers, regardless of the age or condition of the person whom they're providing care for. And that's because respite benefits have been well documented. We know that respite can relieve caregiver stress and anxiety, which in turn may result in their improved physical and emotional well-being. We all also know that by providing time away from caregiving responsibilities, respite can allow family caregivers time to spend with other family members or to engage in social activities that can be very beneficial to their emotional well-being. We've all heard a lot about the detriment of social isolation, and this, of course, is very true for the care recipient as well. But despite these documented benefits of respite, families are still not making use of it. They can't find it or they can't afford it. In fact, a study by the National Alliance for Caregiving and AARP found that 86% of family caregivers of adults are not receiving respite. And the percentage of parents and caregivers of children with special needs not using respite is also quite high. And for families that do use respite, they may not be receiving enough to result in long-lasting benefits. And we know why this is true. The barriers to respite have also been well documented. Again, many family caregivers simply don't know what respite is, or that it's something they might need or could benefit from, or they don't feel comfortable asking for it. For certain, many don't know where to go to find respite or the ways to pay for it. And then, of course, there are the fiscal resources. I mean, nationally, there are simply not enough public resources dedicated to formal respite services. And the system itself, to navigate eligibility, can be very confusing and sometimes even overwhelming. And in the end, a majority of care recipients and their family caregivers don't qualify for publicly funded programs. And as a result, the cost of respite may be extremely burdensome, especially if a caregiver had to give up employment to provide care, which we know they frequently do. And this became even more evident since the pandemic. But even when the family has resources to pay for respite, again, they might be reluctant to leave the person they care for with someone they don't feel is trained or qualified to meet the unique needs of their loved ones. And in the end, most often they simply can't find respite care providers at all. Next slide, please. And we all know this is why we're here today. A very significant barrier is the very limited supply of qualified respite care providers as part of the larger direct care workforce crisis. And if we don't find some solution soon, this crisis is going to grow worse. It's already been estimated that at least 7 million direct care jobs are going to be needed to be filled in the coming decade, at the same time that the pool of working age adults is likely to remain stagnant. And moreover, the field is plagued by low pay and few benefits, which fuel the high turnover rates. We need incentives and workable solutions to identify and recruit new people to the field. Next slide, please. One way that Arch and our partners in this particular initiative are addressing the respite care workforce shortage and the quality of services available is by working with states and local communities to improve recruitment and training opportunities for respite providers. Currently, there are no federal training requirements for direct care workers, and very few states require training for respite providers. And on top of that, we have very little knowledge about what type of training is most effective. We do believe that by offering free training opportunities, we can increase the supply of respite providers and hopefully introduce them to a career path to higher paying jobs. Most importantly, training can help instill that confidence among family caregivers to actually feel better about using respite services. Again, especially for those who are reluctant to leave their loved ones with someone else. That's why I am especially pleased to be here with all of you today, to be hearing from my colleagues about this new training and recruitment effort. We did field test it in 10 states. It's now freely available. And again, along with Kim, I'd like to thank the generous support from the Administration for Community Living and the John A. Hartford Foundation for making this possible. So thank you very much, and I'm really happy to turn it over to my colleagues so that you can learn more about this wonderful effort.
Hi, my name is Lori Stahlbaum. I'm a program and management analyst at the Administration for Community Living, also known as ACL, which is part of the U.S. Department of Health and Human Services. I'm the team lead for ACL's Lifespan Respite Care Program. Respite services are an essential component of home and community-based long-term services. Respite services, we know, can contribute to healthier families and improve the health and well-being of caregivers as well as those receiving care. Respite care services are among the most requested caregiver services, but they are often difficult to find, as Joe was saying, in local communities. ACL is very aware that many family caregivers are unable to access respite services because there are not enough trained providers. And ACL is working to fund solutions to change this. So, for example, in 2020, ACL funded the first, what we called Lifespan Respite Special Projects Grant, the purpose of which was to focus on several critical areas to improve the delivery of respite services. One of those critical areas was the development, testing, and scaling of a respite workforce recruitment, training, and retention program to better try to meet the needs, respite needs of family caregivers of children and adults across all age groups, disabilities, and chronic conditions. NASHP was the grant recipient for this project. NASHP then partnered with ARCH, the National Respite Network and Resource Center that Jill just spoke of, who worked in collaboration with the Respite Care Association of Wisconsin and a researcher from Marquette University. They field tested and evaluated a competency-based online respite provider training curriculum for entry-level respite providers. This collaboration resulted in the development and the rollout, as you'll hear about today, of the National Respite Care Provider Training. ACL is very pleased with the new evidence-informed National Respite Care Provider Training. When we funded this project in 2020, we hoped that some progress could be made to improve the skills and availability of respite providers. Well, I am pleased to say that the National Respite Care Provider Training exceeded our expectations. I want to thank you all for taking the time to attend this webinar today to learn about how this training program was so thoughtfully developed and hear from the South Carolina Respite Coalition about their insights as one of the pilot projects that help make this free national training curriculum a reality. Thank you.
Lisa, I think you're muted still.
Yeah, sorry about that. I thought it would unmute. So hi, everyone. I'm Lisa Schneider, the Executive Director of Respite Care Association of Wisconsin, and very excited today to share with you the National Respite Care Provider Training and how it all came about. Next slide. My cohort in this presentation is Kim. You want to introduce yourself?
Sure, thanks, Lisa. Hi, everyone. My name is Kim Whitmore. I'm an assistant professor in the College of Nursing at Marquette University and had the incredible opportunity and honor to help support the evaluation efforts of this project.
Wonderful. Next slide, please. So from the very beginning, the purpose of this project was to really cultivate a nationally recognized set of core competencies for entry-level respite training. We field tested a training curriculum based on these core competencies and then learn about the development of an innovation and specialized recruitment campaign. We'll talk a little bit about that. But the nice thing about this program is that we do make it available to anyone for free. So very excited to share with you. Next page. So here are some of the core competencies that make up part of the training. These core competencies were developed by a national expert work group. Once they were compiled and honed in on, we disseminated that information out for public comment, which we got a significant amount of public feedback, and we made some modifications as a result of that. And then we applied this information to RCAW's already existing respite care provider training curriculum that we had almost 10 years ago. So we had a base to start from. And so this really worked well by examining out the core competencies that were out there and incorporating them into something that at least already had a base established for it. For those of you who are interested in learning a little bit more about this and the competencies, you can, when you get access to these PowerPoints, there's a link on there to the Arch Respite Network site, so you can dig more into how the core competencies came about. Next slide.
Oh, Lisa, I just want to quick add on that note that one of the unique things that I think I want to call out to folks about the core competencies is the last core competency, which is focused on self-care and recognizing that for respite care professionals, it's important to both recognize the importance of self-care and engage in self-care activities, both for themselves as well as for the caregivers they're providing for, because I think that's often a major issue is we have burnout of providers. And so we really emphasize how important knowledge of and practice self-care efforts are for respite care providers.
Great, Kim, thanks for that, because that was a critical component to add. Next slide. Effort that Kim did to identify all of the core competencies that were out there from existing training. She did a huge crosswalk. So this was a very thorough process. I just want to let you know that. And we boiled it down to so with those core competencies, they were incorporated into 10 different training courses. So you can see on your right-hand side, I know it's really again, via the presentation of you see what the course is, and then you see what competencies are aligned with each course. So the green is the name of the course, and in the light blue is the competencies. So we did do a thorough job in ensuring that all of the core competencies were embedded in the course training. When we developed this, we had a base training and really one for Wisconsin. So when we piloted the project, we had the opportunity to actually allow states to have a couple slides at the end of the main course of the training to add some state-specific slides. And so they were able to promote this in their own state with some of their own state requirements. So we've also made it available in Spanish, and even with the pilot sites, we were able to translate their state-specific training into Spanish as well. So those who were part of the pilot projects got a lot of opportunity there. So again, to the Arch website and to seeing the link to the training modules, just really like touch on that with the 10 pilot sites that we had one main, this takes you to the main page where it's got the different states. But for those that have not had any state specific training developed, we created a national one. So there's no state specific training to that, but anyone across the country, even internationally, have been taking that already, and it's free. They just need to go to that link, register, and they have direct access to that national level respite training program. Next slide. So here's a QR code that will give you a link. I think we're going to talk a little bit more about how to access the toolkit. So I'm not going to double do, I think, what Kim is going to talk about. But the website does have restricted access. So you need to fill out a form to request access. And this is the QR code that will help you make that request. Next slide. So here's kind of what it looks like at a high level. Now, it's a very comprehensive NRCPT National Respite Care Provider Training Toolkit. And so each section has a lot of drop-down components to it. So those are the high-level sections that each have different pages with a lot of specific content within each of those categories. So it really is an online guide to support the recruitment and training of respite care providers. The information contained in the toolkit is really meant for other entities or states to implement this into their, again, at the state level, and some are doing it at the agency level and sharing it. But we do want to stress that the training is entry level. It is not CNA based. It can serve as a stepping stone to a CNA level training. And that's all part of that career building where this is really an entry level training. Next slide. So in regards to the marketing and outreach that we did, especially with regards to recruitment and retention, I'm going to grab my notes a little bit here because I want to be, it was pretty much a deep dive and we learned a lot of stuff. So the first thing that we did was we wanted to bust the mindset of why be a caregiver when you can flip burgers at so-and-so for $15 an hour. We made a real concerted effort of identifying that those aren't two populations that we're trying to outreach to. So we went through a process that was about identifying people we know in our lives that are providing respite and that they're good at what they do. And we identified what are their characteristics, what do they like to do, what does caregiving mean to them, a lot of gathering of data to kind of come up with a profile, right, of, all right, this is our kit. Now, we find these kind of people, how do we reach these people? And we did an analysis and we kind of each state kind of had their own but we pursued those efforts by not wanting to compete with those that are just flip burgers or be a caregiver. So we tried to weed some of that out at the very beginning. We also wanted to make sure that we were using effective communication and language and promotional materials, emphasizing the value of respite care and the impact that it has on family caregivers. I think that is such a critical message for people to understand the impact that it has on us, the family caregiver, that really helps demonstrate the value of what they're providing. But also promoting things like having flexible hours, opportunities for skill development and learning. Sometimes you can have fun. I know my respite care worker used to take my daughter to the movies because that's what she wanted to do. And so, and also it leads to advancement for career growth. So that is part of the messaging in the materials that are promoted out there to help in the recruitment. In regards to the recruitment, we also had another deep dive process that I won't go into great detail, but it is really a component that made this work. And so to do recruitment and retention, to lead people to your training, you need to have dedicated staff time. It is not going to just happen on its own. So you really need to have very specific efforts in regards to creating a pipeline of people that are going to help be a feeder service to help recruit these people on their own. So it kind of becomes an exponential casting of a wide net. And so, as I say here, it's all about establishing those relationships so that once they're established, they're continuing to work with you and for you because we're kind of all in this together. Next slide. So I was asked to talk about a little bit about Wisconsin's experience in regards to this program. And we have a unique experience in that we already had a respite care provider training that we had been using for the past 10 years. But in joining, coming on board around 7 years ago, I learned that a lot of people, there was no consistency to any training. And when we're looking at measuring outcomes, we wanted to have something that was universal, national, free, so we can draw some comparative data and see the results of that. So with us, we didn't start from scratch. We just really augmented our existing training to meet the core competencies that were established earlier on with the national work group. So, excuse me, with the again, with the states that they were able to have their state-specific training, we already had that. We did also offer some additional training benefits. So we did some engagement with Direct Course and with our local colleges here to offer for people who did complete the online training. We paid for spots for people to access more specific and more deep dive training into areas of, seizures, into Alzheimer's, and various other skills that they can add to what they offer a family when they're wanting to provide care. So we wanted to continue to invest in them because they had taken our course. And I think that was really our training, or our experience with this whole training. But I do have to say, and I want to thank all of the pilot projects, the support from ACL and from Arch National Respite Network that really, again, as Lori said, exceeded our own expectations. So thank you very much. Next slide.
Hey, I'm going to share a little bit about our overall project evaluation and highlight a few results from the evaluation of the pilot project. So just really quickly want to emphasize that we really took a multi-layered approach to our evaluation. We looked at the results of the individual learner, the agency, as well as the overall project. So on the next slide, you can see that we covered the following project outcomes. So these are all things we've talked about before, really wanting to ensure we're aligning with core competencies, that we're establishing the strategy for recruitment, we're improving individual knowledge and confidence in the people who take training. We also wanted to increase the number of providers that are trained. We wanted to increase the number of providers who join a registry if that was something that was available in states involved in the pilot. And we also wanted to increase the number of people who indicated they intended to provide respite care, that they were taking this training so that they could provide respite care, not just taking it for fun. And then ultimately, we want to increase the number of people who are actively providing respite care as a long-term measure for this project. On the next slide, you can see how we did that. So for the agency evaluation, each of the pilot sites worked with me as the evaluation consultant to identify their agency-specific goals, and we collected data from them at baseline, 6 months, and 12 months at the end of the pilot. We also added some enhanced evaluation through a social networking analysis and partner mapping, and those activities really helped us to understand those relationships that Lisa talked about and how we encouraged and worked with states to identify what are those key organizations or individuals within the community that are going to help you with promoting the training. Because what we learned early on is if you build it, they will come mentality did not work. So you need to do the recruitment and outreach. And the best way to do that is through relationships with organizations. And then for the evaluation of the recruitment campaign, we really looked at how many people were actually enrolled in the training, how many completed the training, how many joined the registry if applicable, and then how many were actively providing respite care 6 months after completing the training. On the next slide, it will show the individual learner evaluation. These were surveys that were built into the course. So we had an intro survey that included demographic questions about the respite experience, their confidence in the core competencies. So we asked them at the beginning, how confident do they feel they are in achieving those core competencies that were developed? And then within each of the individual courses, there were scenario-based questions that aligned with the course objectives and core competencies. And at the end, we had a post-completion survey that re-asked those same confidence questions so we could measure change in confidence before and after completing the training. And we also asked them, what's the likelihood that they'll be providing respite care in the next 6 months? What barriers do they think they might encounter? And then had a general course evaluation asking about the satisfaction and overall learning from the online program. On the next slide, you can see from the individual learning evaluation, we also did a 6-month follow-up survey. So after people took the training, we marked that and 6 months later asked them if they're currently providing respite care. And if so, how well did the training prepare them? If not, why not? To help identify some barriers. And then we also noticed that there were quite a few people who didn't finish all of the training. They started the training but didn't quite get through the whole thing. And so we decided to do an inactive survey to find out from people who didn't complete the course and stopped why they didn't. And so we sent a very simple 1-question survey to folks. We also were able to enhance the evaluation by doing virtual interviews with learners just to get a little deeper dive into what they thought about the course and ideas they have for improving the course moving forward. So we had a really nice, robust evaluation of the individual learner experience. On the next slide, you can see we're going to next talk about some of the highlights of the evaluation. And this again is from participants who completed the training program during the pilot, which was January to December of 2022. If you look at the next slide, you will see that during the pilot, we had a total of 2,277 people register to take the training and a total of 555 complete all courses within the training. So you'll notice right away that the completion rate was a little low. That has since improved, and I'll show you those numbers next. And what we found was in the beginning, a lot of that was people who were involved in the pilot, like kind of signing up and kind of checking it out, not taking it. We also found out that because we required people to get 100% on the post quiz to pass, that was a struggle for some. So we did some test analytics of the questions we asked and found some problematic questions that we were then able to tweak and change so that it wasn't so hard to get 100%. It was still hard, but not, it wouldn't take people, 3-4 times to complete the training on the second attempt. So on the next slide, you'll see our current numbers. And so this is what we're really excited about, is how this has grown. So we've had an additional, over 3,000 additional people register for the training. So we have close to 5,500 people who have registered for the training. And what I like to see is that the number of completion, that percentage has gone up. So we've had an additional 1,154 additional people complete the training. So a total of almost 2,000 newly trained respite providers since the end of the pilot to date as of June 30th. So it is growing, it continues to grow. We're very excited for that continued growth as it moves forward. And we hopefully have additional people coming on board and promoting the training that exists, or using the Replication Toolkit to develop their own training in whatever way works best for them in their agency or state. Next slide, please. So want to just highlight again, I could talk for an hour about the evaluation, but I have like 2 minutes to do this. So wanted to just highlight a few things about what we learned about the learners and who they were. So demographically, we were actually pleased that we had a pretty representative racial ethnic sample of people who took the training. Always room to grow. We know that the numbers for our Spanish-speaking Latino families are going to increase now that we have the Spanish training. So we're very excited to see those numbers growing. We also had a target population for many of our states around rural communities, knowing that those are communities that often struggle to recruit respite providers. So we were very excited that with that targeted recruitment, we had over half of the learners reporting that they came from smaller rural communities. So I think that is a testament to trying to get into those communities that really need this. And then, as I mentioned earlier, for the pre and post test, we did see a change and improvement on those pre and post test scores. And on average, it took 3 times for people to get that 100% on the post test. So we anticipate that number is going to go down as we've adjusted some of the question wording and options in the test analytic results that we did. On the next slide, you can see that we had a few things that were kind of key findings that we wanted to emphasize. So the first is we were a little surprised that on some of the pre and post confidence questions, we saw that some people actually became less confident. So our thought was that people are going to be more confident after taking this training in achieving the core competencies, but there was actually some that slightly went down, and not by a ton, but just a really interesting slight decrease in the number of learners who said they were very confident. What we learned from our interviews and talking to people involved in the pilot is where this came in is that we really felt that a lot of learners came into this course feeling overly confident that they knew everything there was about respite care. And by taking the training, they kind of learned what they didn't know. And so we heard from people that, yeah, gosh, like I thought I knew everything, but now maybe I don't. So they came in overconfident and I think learned what they didn't know. And so we saw that confidence go down a little bit, which I think indicates a need for additional training as well. Most learners were very satisfied with the training. Over half of the learners had not provided respite care prior to the training. So the good thing about that is these are new people that are adding to the pool of respite providers. And most of them, 80%, said that they intend to provide respite in the next 6 months. So again, the hope is that this translates into people providing respite where there previously wasn't. Next slide, please. So from an agency level, I just want to emphasize 3 things. Lisa touched on this a little bit, but from an agency perspective, the most successful agencies had dedicated staff time to work on the marketing and outreach on an ongoing basis. It can't just be a one and done. You need to continue to have touch bases with those partners in the community and organizations that are helping you get the word out and serving as feeders for recruitment into the training. We also saw that those strong relationships that they developed really helped, not only for getting more people information about the training and getting more people to take the training, but we saw a lot of secondary benefits of those strong relationships, that people then got connected with organizations they really hadn't previously, and it led to other collaborations and partnerships that strengthened the lifespan respite programs in their states. And then lastly, and I think this is a really critical one, is that states that had a provider registry or some way to connect learners to opportunities to provide respite were more successful. We heard from people that took the training in states that didn't have that, that they were sort of like, well, I took the training, now what? How do I find a job? And so states that had a way to connect people were more successful and had more people actually complete the training. Next slide. I think that's it for me. So I am turning it back over to, I believe Kathy is next. Yes, no, or is this you, Lisa?
I think Lisa.
Or you want me to take this, Lisa? Sorry, I forgot about this slide. So I can take it, Lisa. So this was mentioned a little bit earlier about the National Respite Care Provider Training Toolkit, that this was a product that was developed from this training. So as a reminder that there is a training out there already that's developed, free, ready to go. You can use it. It's a sort of general training at the national level. However, if you're interested in adapting that and adding custom information to make it more relevant to your setting, the toolkit is the way to go. It gives you step-by-step guidance on how to replicate the training. It has all the curriculum, all the pre and post test questions, everything you would need to replicate this training in whatever way makes the most sense for you. And there is a form that you have to fill out online to request access to the toolkit. And that includes some terms and conditions of use, because we want to make sure we retain the core competency alignment with this training. And so there's specific language on how you have to call this and what sort of changes you can make without it not sort of counting as a replication of this training. And so if you fill out that form, we will review it, approve it, and then send a link to the web-based toolkit for you to review. That's just a screenshot of what that toolkit request form looks like. Next slide, please. And here is the QR code. Again, if you haven't already grabbed this, I know it's posted in the chat as well, but if you're interested in requesting the training replication toolkit, please scan this QR code, visit the website. We've had over 150 requests so far to access the toolkit. So people are using it. It's really exciting. We hope those requests continue to go up. Next slide, please. And then last note on that is that we do also have promotional wrap cards available. So again, these can be fully customizable for your state or organization. So if you're interested in that, they are available on the Toolkit website, or you could email Lisa and we can get you the template for that. So this is a nice promotional card to promote the training as well. Next slide, please. And lastly, just want to re-emphasize the acknowledgement of our supporters and our amazing collaborators on this project, ACL and the John A. Hartford Foundation, and of course, RCAW, NASHP, and ARCH for helping to make this training and the replication toolkit possible. Thank you so much. Next slide. Now I'll hand it over to Kathy. Yeah.
Thanks, Kim. I am Kathy Mayfield Smith, and I am the Associate Director with the Institute for Families and Society at the University of South Carolina, but I'm also the co-founder and current board president for the South Carolina Respite Coalition. Next slide. So just a little bit of background about the South Carolina Respite Coalition. We are a statewide respite coalition, and we work to ensure that respite is available throughout the lifespan to all South Carolina families caring for a child, adult, or older adult with special needs. And to do this, we work with a variety of state and local agencies and community partners. But we've actually been providing training for or had been providing training for a little bit over 8 years, but as a part of a contract with our the South Carolina Department of Disabilities and Special Needs. And that was really a closed training series that was only available to families who were receiving respite through the DDSN's Family Selected Respite Program. But our experience with that really highlighted the need to expand the recruitment and the training and retention for the respite care providers, as families often couldn't find providers. And so, you know, being a part of this program wasn't really helpful if they couldn't get a provider in. So the families and case managers were requesting lists of providers, which we do on an informal basis for them through people who have received the training through this program, but that in no way met the need for those families. So we've really been exploring ways for a long time of how to increase our training capacity to help those caregivers across the lifespan and the care needs. Next slide. So our approach to this pilot was we really wanted to build on what had already been developed. We had been following and talking to Respite Care Association of Wisconsin for a long time about the training that they had. And so our approach really was to just, when we had the chance to be a part of this pilot, we jumped at it because it allowed us to build on what was already developed, both by us and by Wisconsin. It allowed us to expand and complement that existing training. And I think the National Respite Care Provider Training Pilot really provided a lot of what we were looking for. Specifically, it provided a standard competency-based introductory training that covered key aspects of providing respite care. It allowed us, as has been mentioned before, it allowed us to customize some of those modules so that we could put South Carolina specific information where it was needed. And with the exception of that customization, though, it really provided a complete training series. Although it was introductory and basic, it provided something that was ready to implement that we could make available to interested people immediately. It also offered economies of scale. I think this was a real benefit for being a part of that pilot group, is that we were able to share in Wisconsin's learning management system license in order to test this process for us. But I think best of all, it offered a shared learning experience, and you've heard a lot of that from both Lisa and Kim, but it really shared a learning, it gave us that opportunity to learn from them and the experience that they had, but also the other states that were a part of this pilot in order to really test and learn about different strategies. Next slide. So some of the major outcomes for us in this process was it really did help us build that infrastructure to consolidate all of our training that we were developing for distinct audiences. So we have the South Carolina specific training for DDSN. Now we have the more broader training that we can offer to all potential respite care providers in South Carolina for all families, but it also allows us to add modules. We're currently developing a segment for family caregivers. So it really gave us the foundation upon which to build our own training capacity. I think, you heard the numbers that Lisa and Kim shared before. In South Carolina, we have to date, and this includes the training time, the pilot time, but we have 802 learners who've actually enrolled to date. And similar to their experiences, some of those were from people, participating from some of the agencies who were kind of testing things out. But we've actually had 146 complete people who have completed the 10 modules in that learning course. And so we have 146 additional new respite providers in South Carolina. We were one of those states that did not have the registry. And certainly that did hinder our ability to connect those providers who had gone through the training with families. And so that is our next step. It gave us the foundation for developing that registry, which we are currently in the process of doing and are really excited about doing that. As a matter of fact, we just had our state committee meeting yesterday, and lots of good suggestions as we develop that of how to link it with other registries in the state, like the CNA registry. And so we're really excited about that opportunity in order to be able to kind of close that gap and connect them to families. I think it's also in building this training capacity, it has given us the opportunity to really reach out to other state agencies, and from a sustainability standpoint for us, really try to bring the training together for respite. We can add additional state-specific training that is necessary, but also I think offer that basic training for those agencies that have no training in place at all. Next slide. And this, just to reiterate some of the same lessons learned that you've had, one of the things that we realized is that we really did need to have dedicated training staff to manage the system, but also to provide that learner support to be able to respond to questions, emails, troubleshooting if people are having problems with the system. But I think also, as has been said before, we need dedicated staff for that marketing and outreach in order to really bring in the most people and recruit the most people as possible. I think the other thing is that I would encourage anybody who's going to be a part of this to try, different marketing methods, just to see what is most effective. Because although Lisa and Kim highlighted, I think specifically the relationship-based things and outreach to those partners, that is, I think, key. But there are other strategies that I think different states found effective that may have worked with specific groups in their state. So I would encourage everybody to just use different options. And again, just repeating that it's an ongoing process. It's something that you have to do continually. It's definitely not a one and done. And when you see the people coming into your system falling off, you really need to get back out and reach out. I would also, last lesson learned, we've had a lot of staff turnover in South Carolina. So people who participated in this pilot aren't, all of them are no longer here. So we are using that toolkit. We have requested it and are utilizing it. And there is a lot of good information in there, tested strategies, good thoughts. And so we're using that as our own guide in continuing the development and increasing marketing and awareness for our training, as well as the development of that registry. So all in all, it's been a great experience for us, and I would encourage anybody who is interested in developing training to look at this National Training Resource Toolkit. Thank you.
Great. Thank you all so much. A lot of great content covered in a short period of time. And as a reminder for attendees, we're now moving into the question and answer portion of the webinar. So feel free to submit any questions in the Q&A feature at the bottom of the screen. Or if you would prefer to ask your question live, feel free to raise your hand and I will unmute you. And we already do have some questions coming in. So we have Nancy here. She raised her hand. So Nancy, I'll take you off of mute. And if you would like to ask your question, feel free to do so.
Okay. Can everyone hear me?
Yes.
Yes. Well, thank you everybody, first of all, for all of this information. I think this is great for all of the home care agencies that are probably struggling to find a curriculum or training materials. for a field that it's seeing such high growth. So thank you for doing that. But I did have a question, or maybe if you can clarify, you guys said there's a replication toolkit. What does that mean? Does it mean that the agency can kind of cater it to their specific agency needs or requirements? If you can talk a little bit about that.
Sure thing. It's Lisa with Respite Care Association of Wisconsin. So the toolkit is really meant for you to even at the agency level to go ahead and use this training. So it's free to anybody at any level. So at a state level, at an agency level, at a county level. Right now it comes with the core curriculums. If your state has some specific requirements, we can work with them to incorporate them into the training. That would be taking it a step further, but what the toolkit itself does is it walks through your assessing your readiness. Are you ready to do this? Do you have the team to do this? It does have the core curriculum in there. So if you're wanting to go forward, there's several options that are described in the toolkit that can allow you to utilize the training in multiple ways. One of which is to download it all and put it on your own website and make it available to people with if it's an agency. A lot of, we initially set out to really have this be a training to populate our registries, but what it ended up happening is a lot of agencies were using this to onboard staff. So if they weren't providing CNA level care, this was a great way to onboard them for free. Also, colleges are using this as part of some of their curriculum. So you can walk through it, and if you have questions, you can give us a call. But it's really meant for you to walk through the process and determine if it fits your needs, and if it does, you could determine what method you want to use the training. And then if you have questions on that, you can give us a call.
And then you thank you for sharing that. And then you said that a request can be made to kind of alter or modify it based on the state requirements. For I'm from California, and there are some state mandated requirements for home care aides. And so in that situation, I did look at the links that you shared. I didn't see a California one. So this is one of those instances where we would reach out and kind of work on that.
Yes, you could either have the option of using the national training, which is not state specific, but if you did want to engage, you can download the training, and then it allows you, I believe there's a couple of slides where you would do your own research and incorporate your state specific training requirements into the training that you would offer, and still be able to call it the National Respite Care Provider Training.
Okay, thank you.
You bet.
Can I clarify that a bit though, Lisa, if you don't mind?
Yeah, absolutely.
I think we are being very careful though that by getting people to agree to the terms and conditions, that there be no changes to the 10 courses that make up the core curriculum, because those are the ones that have been field tested and align with the nationally recognized core competencies. So if you were to make changes to those 10 core courses, we would have no way of knowing if the training still met the core competencies. But again, as Lisa said, you do have the option to add additional slides where it's indicated if you wanted to make some of the information state specific.
Thank you.
Thanks,
Great.
Jill.
And we do have a few questions in the chat here. One person said, this is very exciting, and in the Wisconsin pilot or in the South Carolina pilot as well, have you been able to identify what are barriers to providing respite services for people who completed the training? And were the barriers different for providing respite for caregivers of children compared to older adults?
Good question. In regards to the training, that has only been a positive all the way around. More of the barriers come in regards to the funding source that is funding them. So the children's long-term care support waiver is very different than the adult long-term care waiver. So the children, at least in Wisconsin, do require some level of training approval to be listed on the state registry, where on the adult side, they don't need to have any training at all. They can just pass the background check. So each state is a little bit different. So I can only give you information at least that is Wisconsin specific. But
Yeah, I would say that the same kind of thing. I mean, our biggest barrier right now is not having that registry, so not really being able to connect families who are looking to the registry providers that are there, but also agencies, Medicaid, and different agencies are going to have their own requirements. And again, this is a very basic requirement that I think can meet, you know, certain criteria for children and adults, but there's likely to be additional training that may be needed depending on the needs of the individual family. And so I think it's important, you know, to have that communication with the family as well, so they understand what this training is and what additional specific training may be needed for the individual.
Great. And then we have a hand raise from Debbie. Debbie, I'm about to allow you to talk. And you should be able to talk now.
Okay, can you hear me?
Yes.
yes.
Okay, so I'm from Wisconsin. And you know, I filled out the form for the toolkit. Then where does it come from? Where do I go to get it? Does it take a couple days, or I actually did it last week.
Okay, well, that is something I can follow up on, because you should submit the form. Some of this is submit the form, it automatically comes into us, it's reviewed, and then it should be immediately that an email is returned to you with a link to access the toolkit. So Debbie, I'm going to write your name down, and I'm going to follow up on it immediately after this webinar, so you get the access.
Yeah.
It always
Debbie
helps to check your spam folder too.
Yeah.
Okay. Yeah.
Yeah.
I have to check that all the time. Isn't that crazy? In this day and age, you still got to check your spam.
Great. Thank you so much, Debbie. We have a question in the chat. We offer respite services to individuals with developmental disabilities, such as through California's regional center system / Lanterman Act. Do you provide training for respite caregivers working with people with developmental disabilities?
Well, again, the training itself is entry level, but having an intellectual and developmentally disabled adult daughter, yeah, they're for her needs, a person going through this training is enough. That's actually, you know, at least in Wisconsin, a good chunk of the folks that those that are older adults probably have a higher need that we're seeing with some of our respite care workers. And so when we did the connection with the direct course, we allowed them to get dementia specialist and dementia generalist training, so they can hone in more deeply on some of those specific items, you know, regarding behaviors and stuff like that. When it comes to, we've also talked about, you know, and maybe Kim can touch on this, because there's another thing that we're exploring for children with special health care needs that have more high medical needs, more than just intellectual and developmental disabilities. So that's where the additional training comes into play. So the training itself, the NRCPT is a core, but we want to encourage all states that if you do that, you know, the biggest thing with respite care workers is they want to feel valued, and as long as you continue to invest in them with development opportunities, you will keep them much longer. Kim, did you just want to touch base on what you're doing?
Sure, real quick. So there's another training that I've been involved in that we developed several years ago called e-home care, and I'll get the link to put in the chat in a minute. Right now that course is only for the care of children who have trach and vent dependency, but we're in the process of adding 7 additional modules to that learning platform, and it should be released by January. So we're adding additional modules all centered around the care of children with medical complexity. So it's a nursing focused, much higher level acuity, and really exciting training. But the e-home care modules are also available for free.
Right.
And I just want to say that our training is only training that doesn't require some level of supervision to sign off on to say that they have been able to accomplish this training. So it's all online, and so we're not able to supervise and say that you're certified in this. We can just say you've completed the training.
Great. So I want to be respectful of folks' time. We have about 2 minutes left. But one question was, if you had to distill, I know we covered a lot through this presentation of just tips for folks that want to implement this training. If you could distill it down to 1 or 2 lessons learned or tips that you would want someone to take away from this, what would they be?
Assessing your readiness, because there's a lot that goes into it. So if you are starting from scratch, you want to know that you've got the team that can dedicate itself to the outreach, marketing, and recruitment. You want to have the infrastructure to determine if you have the capacity to download the training and host it on a platform. Where would that be? Does it cost any money? Do you have a registry existing? This is a touchy issue with some states, so you'd have to go through and see if your state would, is agreeable to you moving forward with that. So those are, again, the assessing readiness is probably the biggest key to look through to determine their next steps.
Great. Kim or Kathy, do you have something to add to that?
I just want to emphasize sort of big picture that right now, like as soon as this webinar ends, you can go and take the training that exists and promote it. Again, there's state-specific trainings from the states that were in the pilot, and then there's the general national training, both available or all available in English and Spanish. So those can be used right now. And you can share those broadly. We want you to share those broadly. They're free. People can take those trainings. And then do that while you're exploring the option of developing your own sort of custom version or hosting this training in a different way using the toolkit. So I just want to underscore that you can use this today to help promote and train your respite care workforce.
Great. Well, again, thank you all so much. We really appreciate it. And just a reminder to folks, we do have a brief evaluation in the chat that will also be sent out at the conclusion of the webinar, as well as the PowerPoint and recording. I know there's a lot of links that we put in the chat, but don't worry, those are all embedded in the PowerPoint slides, and we'll make sure that you all get those. But again, thank you all so much to our speakers, and I hope you all have a great day.
All right. Thanks.